A lot of people wonder how anybody could possibly oppose an organization as benevolent as Planned Parenthood. I have a lot of reasons for disliking and distrusting them, and I'm going to cover one of them today, one that certainly should, in my opinion, be enough to at least make you look askance. This is Christina with the Sisyphean Journal, and today is February 28th. Why would anybody dislike Planned Parenthood? Why would anybody look at them with anything other than complete trust? Well, Diana went to them with complete trust and wound up leaving her two small children motherless. She was 25 years old and 19 weeks pregnant when she went to a Planned Parenthood in Los Angeles for a safe, legal second trimester abortion. Before the day was out, she had bled to death, leaving a 4-year-old and a 2-year-old to grow up without a mother. And California taxpayers footed the bill for this fatal abortion. Diana's husband later filed suit, alleging that it was the abortionist Haste that had caused the lacerations that had killed his wife. Planned Parenthood's website said that the type of abortion Diana was undergoing should take anywhere between 10 and 30 minutes. And from my experience reading these cases, it probably should have taken about 20. David, Diana's husband, said that Dr. Mark Maltzer rushed through it in only 6 minutes. And we will get to more reasons to look askance at Dr. Maltzer. Okay. After the abortion, Maltzer did realize that Diana was hemorrhaging, and I got to give him credit for this. Unlike in some other cases, at least he did have her rushed to the hospital. There they performed an emergency hysterectomy, but even with all the blood they pumped into Diana, they couldn't do anything for her. She was pronounced dead at 2:45 p.m. And her autopsy verified she had bled to death because of lacerations to her cervix. Now, the family's attorney noted that in 2000, the same Planned Parenthood had rushed another woman through a similar 6-minute abortion, lacerating her cervix, rupturing her uterus, perforating her sigmoid colon, and causing the loss of 2 liters of blood. In that case, they delayed before transferring her to the hospital. Fortunately, she survived. Now, interestingly enough, the medical board didn't take any action against Dr. Maltzer. But thanks to pro-lifers raising hell, notice it was pro-lifers, it wasn't pro-choicers who said, this abortion didn't seem as safe as it was supposed to be. Maybe the state needs to step in and look. No, it was the pro-lifers raising hell. And the state went in, inspected the clinic. They cited them for failing to institute a necessary change in medical protocol relating to the use of laminaria in these procedures. Those laminaria are those little seaweed sticks that they put in the day or sometimes several days before the abortion, depending on how far advanced the pregnancy is. They absorb moisture from the woman's body, they expand, they open the cervix. There was no evidence to show that they had completed an assessment of the competency and credentials of the doctor they were trusting with Diana's life. And it wasn't a doctor who did the informed consent with Diana, it was a reproductive health specialist. Diana's hemoglobin was so low that the inspectors said they shouldn't have even tried to do an abortion on her that day. At the very least, they should have had a doctor informing her how dangerous this was with her hemoglobin levels dangerously low. They failed to follow their surgical policy by administering the drug Cytotec to Diana 90 minutes before the procedure the way they were supposed to. They had given it to her the day before. And they did not inform their own governing body about Diana's death, and they didn't report it to the state, and I'm going to go out on a limb here and guess that they didn't report it to the CDC either. And they kept inadequate records about Diana's care. Now, the news coverage said that Planned Parenthood made corrections. I do not have a lot of faith in their corrections. 5 years later, another Southern California Planned Parenthood, there a nurse put laminaria in the cervix of a patient named Edrica, in spite of the fact that she had an obvious vaginal infection. And those laminaria sucked that infection right up into her uterus and killed her. And this failure to assess the credentials of staff, there was a case where, now this was back in 1981, so this is across time, and it was in New England, clear across the country, so across time and across geography, failure to stay on top of their staff credentials. A woman stopped breathing after an abortion, and it turned out that neither of the nurses attending to her had current CPR certification, and they botched the CPR appallingly. The one nurse was doing chest compressions on the woman's abdomen instead of on her chest. And the person with the ambu bag, to put air in, was only puffing out the woman's cheeks, not inflating her lungs. And there are other women who died because of screw-ups at Planned Parenthood. A young woman named Cree was sent home with a post-abortion infection. She was staying at her mother's house because she felt unwell. Her mother went into the guest bedroom to check on her and found her cold and stiff. A young woman named Tanya left a 1-year-old motherless after she bled to death after an abortion at Planned Parenthood. Remember how I said I give them credit for at least getting Diana to the hospital promptly? They delayed 4 hours before they took Tanya to the hospital. In 2009, a 17-year-old named Roselle went to Margaret Sanger Center of Planned Parenthood in New York and died from apparent anesthesia complications. Her family in their lawsuit said that Planned Parenthood failed to monitor her adequately. In 2003, a young woman named Holly died of toxic shock syndrome after chemical abortion at Planned Parenthood. The second dose is supposed to be administered inside the cheek. This can cause nausea and vomiting. So against FDA recommendations, the Planned Parenthood just said to use it as a vaginal suppository. And researchers looking at a rash of toxic shock syndrome deaths that hit very quickly in otherwise healthy young women, including another Planned Parenthood patient in California, not just Holly, concluded that it was probably using this drug vaginally that started the cascading events that led to the fatal toxic shock syndrome. So, I don't know. I consider these deaths at least reason to look askance at Planned Parenthood and to question whether they're really as benevolent and really as meticulous about the quality of care that they provide as they say they are. Now, some people say, well, it's only a few dead women. Some people will say, well, come on, they do a third of all abortions in America, hundreds of thousands of abortions a year. So, what's a few dead patients? Well, first of all, every dead patient is a tragedy. It's a family that's lost somebody dear to them, and it's a young woman who has had the rest of her life taken away from her. And look at the circumstances. Rushing through a late second trimester abortion in only 6 minutes. Dragging ass for 4 hours before taking a hemorrhaging patient to the hospital. Having staff that don't have the first idea how to perform CPR. You'd been better off with a 12-year-old who had taken a babysitting course than with these two Planned Parenthood nurses. I just don't think that this is something that we can just brush off as not mattering. I think that at the very least, Planned Parenthood needs to clean up their act before they get any more tax money.